Thank you, everybody. I want to start by apologizing for the fact that we don't have a sign language interpreter today. We learned this morning that there wasn't one available for us. We'll be posting a fully captioned video of this news conference as well as text transcripts online, so anyone will have that online for you. The latest COVID numbers here in Massachusetts as of yesterday: 454 confirmed cases, a total now of 133,359 confirmed cases in the Commonwealth. There were 8 deaths that were recorded yesterday for a total of 9,323 deaths. In Boston, our numbers yesterday in Boston were 63 new cases for a total of 17,712. We had no deaths yesterday, and our death total in Boston remains 764. Our prayers go out to the families of those who lost loved ones during this terrible time, and also to the families that are sick and suffering with COVID-19. At this point, I'd like to ask Marty Martinez to come up to the podium and talk about the latest numbers here and data on COVID-19.
That's it. Thank you, Mayor. Since the beginning of the pandemic, the administration has committed to sharing data with all of you and with the media in a timely and transparent manner. That's why the mayor has held these conferences and why we've continued to make sure that we're sharing the latest data collected by the Boston Public Health Commission. We also accurately update the website at boston.gov/coronavirus, as well as at bphc.org when the data is released. Sharing clear and accurate information is essential to making sure that we're making good public health decisions and being led by science, which the mayor has been from the very beginning. We all need to understand the situation that we're dealing with so we can work together to limit the spread of COVID in Boston and limit the harm that it causes and move forward safely and equitably. And that's been at the center of what we've been attempting to do all along the way. The most current data that we have is for the 7 days ending on Saturday, October 3rd, and I'd like to share a little bit of information about that data. The number of people that have been tested have roughly stayed the same. Around 1,800 individuals have been tested per day on the average. The average number of positive tests increased from 65.6 to 73 positive tests per day. And that has created a 7-day moving average of a positive test rate of 4.1%. That's up from our previous 7-day average that we had. We continue to see increased COVID activity week over week, and this small increase has also spread into some different neighborhoods. In particular, for the last week, Hyde Park saw a significant increase in its positive rate. Dorchester, which had gone up, remains level, and East Boston, which we all know had been very high, close to 12% in the past, has seen a small decrease as well from week to week. We continue to respond to this activity to make sure that we can get folks access to the care they need, with testing resources, with outreach in multiple languages, and with steps to target communities that are seeing the biggest increase. That's been door-to-door activity, business-to-business activity, increasing access through our mobile testing, and making sure that we can take care of those who need it the most. The larger question in front of us is whether this increased activity is a trend or a bump in the road. And that's the really important piece to keep in mind. At 4.1%, this is the first time we've been over 4% since early June. And so as we see this, and we've seen a small uptick over the course of the last month or so, what we need to look for is whether or not this is a trend, as I stated, or simply a bump in the road as we continue to live with COVID. As we continue to look at the metrics, we will continue to do that, as well as the state metrics we know put us in the red last week and will likely have us in the red again today. But 4.1 does, for the first time, put us over a threshold for taking a harder look at where we are with reopening as specific to Boston Public Schools. So the administration has been consulting with our public health experts at the Boston Public Health Commission, as well as at the state, about what kind of guidance this data calls for and what decisions need to be made in reference to the COVID spread in the community. Given that information, I'll turn it back to the mayor to tell us a little bit more about where we are.
Thank you, Marty. Just give me 1 second here to find my place again. I want to thank Marty Martinez and the team at Health and Human Services for the great work they do. Throughout this pandemic, in addition to sharing the data, we have made decisions here in the city based on science. Our priority is to protect Bostonians' health and safety with special consideration for our most vulnerable residents. That's how we're moving forward based on the latest data. The citywide positive rate puts us over 4% threshold that we established for moving forward in our phased-in hybrid learning plan for the Boston Public Schools. This is somewhat conservative threshold that we have here. The state, the national, and the global pandemic health standards generally focus on specifically a 5% test rating. That's consistent with our overall cautious approach. So we believe that it's prudent at this time to pause the school reopening plan. And just as I talk about this, these are difficult decisions. There's a young man here that you don't see at home, and he's holding a sign, we need school. And I understand the importance of having school for our young people. So what we're proposing today, what we're going to do today, we'll push back the earliest possible start date for phase 3 from October 15th, which was next week, to October 22nd. It means as of now, K0, K1, and K2 kindergartners will enter school no sooner than October 22nd. We will reevaluate where we are based on the data that we see between now and then, and there's many other dates that we'll be looking at to see where our positive rate is throughout the city of Boston. Today, Wednesday, our schools are fully remote, but we will reopen tomorrow to continue serving the highest need students in our district whose families opted to begin with hybrid learning last week. This decision is based on the guidance of our public health experts and in consultation with state officials in public health and in education. And it's consistent with our decision to prioritize our highest need students in the plan. These are students with disabilities that require in-person supports, who require English language support, who have limited or interrupted education, who are experiencing homelessness, or who are in DCF care. For many of these students, not being in school presents a risk that cannot be mitigated the way that the risk of COVID can be. The risk of moving backwards, that is very difficult to recover from. We are hearing from families as well as advocates and experts that their return to school has done wonders for young people's health and well-being. I witnessed it myself last week when I visited several schools. I saw smiles on little kids' faces. I was at the Ellis, and I saw a little girl, some of the press was there. There was a line of press and a line of teachers. A little girl ran by us all up to, and hugged her teacher. She was so happy to be in the school. At the Carter School, where there was 3 students, nonverbal, learning how to communicate, one child through a smile, another child through the movement of his eyes and his head. Amazing things are happening in our schools. It's important for us that we continue to have those amazing things happen to our schools, in our schools, and to allow families and our young people in particular to have those experiences that they've missed out on for the past 7 months. The relationship they have with their teachers and therapists mean the world to these young people. It's something in a lot of cases that can't be accomplished by Zoom. I want to be absolutely clear. We will continue to ensure that our schools are prepared to protect the health and safety of our students, our teachers, and all of the people and any of the people that are in them. So far, about 1,300 students have been in our schools each day since Thursday. With 125 schools, that's an average of a little over 10 students per school. With the protocols that we have in place, the public health guidance says we can provide the vital in-person learning services for all of the highest need students who have decided and parents have decided to opt in. I want to thank everyone who has done amazing work in serving these students. I want to thank the teachers and the therapists and the counselors that I spoke to last week, and the excitement and joy in your face for welcoming your kids back. I want to thank the nurses and the bus drivers and the custodians for making sure that there's a safe place in our schools and to make sure that our kids are safely transported from their house or their street corner to their schools. I want to thank the custodians who are working around the clock, not only to get our schools prepared, but continually making sure that our schools are clean and sanitized. I want to give a special shout out to the principals and the school leaders and the administrators who have spent hours and hours and hours not just preparing our schools to be open, but spending more hours on Zoom calls with the district to talk about the needs that you see in your school and that your kids and your teachers need. We are all committed to meeting everyone's needs together. We continue to make hybrid, in-person learning an option for them, as long as the public health guidance supports that. And we are committed to keeping every family's choice at the heart of their plan. Every family, every student, every grade will continue to have the options of fully remote learning. We all know that these are trying times for everyone. There are no easy choices. But we have to follow the public health guidance, and we have to listen to those impacted around us. This decision came down to me realizing that our highest need students need the district as their choice. We are their chance for success to help them move forward. We cannot take this away from them right now or so soon after they started last week. Not now when there's an opportunity backed by public health to have them in schools. There's too much at stake for our young people. Every single day matters. They deserve our best efforts. We are Boston. Throughout this pandemic, we figured out a way to make it happen. And there's no difference in what we're talking about today. Now, I'd like to ask Superintendent Brenda Casilius to come up and say a few words.
Thank you, Mayor, and thank you for recognizing the incredible hard work of our BPS staff to ensure that our buildings are safe for both our students and our teachers and all of our educators in ensuring that they can come back to school. Thank you also to all of your cabinet members and staff members within the city. This has truly been an all-hands-on-deck approach, and we feel incredibly supported by you and the whole team. And thank you, Chief Martinez, for guiding us through this difficult time. Throughout the development of this plan and the implementation of our BPS reopening plan, we have valued and put first our students, public health, safety, and equity for both our students and our staff. We've also respected family choice and prioritized our highest needs. Last Thursday, we welcomed back our high in-person priority students back to school, and I got to do that with you, Mayor, and it was an absolutely fantastic day. It was great to see our students arrive for their first day of in-person learning at their schools in over 6 months. It was heartwarming to see because this is what we've been working so hard for these past several months, and to see all of our teachers welcoming them with all of their love. We could feel the energy and excitement of our students. Students told us themselves, and even told some of you in front of the cameras outside the Ellis School in Roxbury, that they missed their friends and their teachers and how happy they were to be coming to school. 6 months is a long time for students to be out of school, and this wasn't just any 6 months. It was and continues to be a difficult time for all of us, but this impact is not felt the same for all of us. Working in public education, we saw inequities that already we knew existed become exacerbated by this pandemic. During a time of such uncertainty, it is expected to feel anxiety, to be a little bit scared, and to want more certainty and more comfortability for ourselves and for those around us that we love. For so many of our students, they need this added support and critical services that we provide for them when they're inside our schools. They need the caring adults that love them, our teachers and our school leaders who have been coming every single day, our nurses and our paraprofessionals who day in and day out provide these services, and all of our wonderful staff, from nutrition staff to our bus drivers to our central office staff. Our facilities are safe and ready. The BPS team has worked tirelessly over the last few months to get them ready. They've repaired windows, they've replaced filters, they've upgraded bathrooms, installing sanitation stations. They've been providing masks and other specialized PPE equipment for those who need them, arranging furniture and posting signage for social distancing. We have foggers that sanitize our school buildings between groups coming and on weekends. We've been ensuring that there's been enough supplies and hand sanitizer and other sanitation products at all of our schools. I'm so very proud of all of our BPS team and very confident in our safety and health protocols that we've put in place. Working in conjunction with the Boston Health Commission and our City of Boston colleagues, we've put all of this in place to ensure that we could stay open for our high priority students. As the mayor mentioned yesterday, our schools with the highest amount of students had 50 students attending in person. Many of our schools have had just a handful of students in them. In total, yesterday we saw under 1,300 students attend school in person, and this has been about our daily average. And we think we can continue to do that for these 1,300 students that are coming to us and need us the most. That is fewer than the amount we were anticipating. Even this week, families and students who have been recognized as in-person priority have decided that they would rather keep their kids at home. But many families know that their children benefit from in-person learning, particularly our students with disabilities, our English learners, and our students experiencing homelessness, and other students who have high needs. Recognizing the limited number of students in our school buildings, and after consulting with Boston Health Commission, the Mass Department of Public Health, and our DESE colleagues, we have decided to continue prioritizing our students with high needs for in-person learning. I want to reiterate that our hybrid learning model is opt-in. If at any point a family decides that it is best for their child to learn remotely, families can easily make that change. We have a form on our website available in 10 languages, and they can also notify their teachers or their school leader. We are all watching carefully the public health metrics to determine if this recent uptick is a trend or if we have to continue to evaluate our current plans and adjust those accordingly. Every time I have an opportunity to stand here before you, I feel compelled to ask our entire community to please follow the public health guidelines so that our numbers stay low and we can continue welcoming our students back to school. It is truly going to take a village. We need you to wear your mask, wash your hands frequently, clean high-touch areas, do not go out if you are not feeling well, and please avoid crowds and large social gatherings. We all have to do our part. Our children are depending on all of us, especially those with disabilities. And now I have the great pleasure of introducing the chair of our Special Education Parent Advisory Council and our SPED PAC, Roxanne Harvey.
Thank you. Good morning. My name is Roxanne Harvey. I am the current chair of Boston SPED PAC, the Special Education Parent Advisory Council for the district. I have 2 children with disabilities, and similar to many of our families, my children struggle during remote learning. Some of our children, in-person learning is just a necessity. It is not even that so I've heard people say, oh, the babysitter. It is that some of our children have regressed and decomposed so much of in those 6 months when there was no in-person learning or access to the services that they require to thrive. So here I stand, and I'm really focused on parent choice. Families make the best decisions they can for their children. And these 1,300 or 2,600 parents that have made the decision for in-person learning for their students, they made that choice based on the fact that their children needed to be back in school to thrive. These children could not have another lost year. This opportunity to be back in school has changed our children. Just seeing them and start to open up, and just these 2 days of being in school, it's almost like seeing different children, honestly, when you just see the way that they are opening up and some of them are starting to talk a little bit more, that starting to lose some of those social skills, and even with some of the therapies they were receiving. We are seeing a change, and we know that in-person services need to remain for our high-needs students that have disabilities and our other high-needs students that are English language learners, homeless students, TCF care and congregate care, students that need in-person learning, that option. And the key word is option for our parents. Because as a parent, I stand here saying that I choose in-person learning because my children need it, but if another family chooses all remote because that's what they've decided is best for their family, that is their choice, and that is what works for them. So we are grateful that the district has decided to continue to prioritize in-person learning services for our high-needs students that we all know desperately needed it. We respect, like I said, we respect the decision of those who choose all remote, and we want that same respect for those of us who have chosen in-person services for our children. You know, our schools must keep open for these high-needs students. They really have suffered enough, and they can't get this time back in their life. It's hard to recoup a school year when you are already suffering and we're behind because of all the different things going on. Our children are resilient, but they still need these services. At home, we can't provide all these wraparound services that the school provides when our children are in school. And as large of a district as we are with 55,000, I think we can handle 1,300, honestly, safely, because those families believe that the school district can keep their children safe. That's why they sent them in. We don't send our children in to be unsafe. We wouldn't do that. We love our children. So the fact that we sent them in, trust me, that means that we believe that they are safe in the school setting and their overall well-being needs in-person learning. We know that there are some children that just cannot learn remotely, and we can't ignore that. Even if it's a subpopulation, it may not be the majority of kids, the majority may be able to learn remotely, but we have to keep in mind that there are some that just cannot. So even with the 4 days or 2 days, remember, those that can't, that does mean that the days school is remote on that Wednesday, they are not able to access that. So they don't even get 5 days of learning. So they're already getting less no matter what, because there is a day we don't provide in-person learning. I think we just need to continue to pivot and be creative. We're learning more information as far as safety rates and other things going on and making modifications to the schools and supplies. And we need to keep the focus on the children and what their needs are. If we all come together at the table with the focus on what our children need to be able to thrive and allowing families to choose what is best for their children also, then, you know, we will be a better society for it. I will say, because, you know, there's been a lot of talk just about blaming that. Our families, we're way past the blame game, who's at fault, what wasn't planned for. At this point, it really has to be about getting children the services that they need right now. You know, I've always said that society is judged by how they treat their most vulnerable populations. And, you know, we really have to keep high-needs children as a priority and ensure that their needs are met. Whether it's in school, in community, or in home, our children's needs must be met. And we want to thank all the service providers, from the bus drivers, the nurses, the teachers, the paras, the superintendent, the mayor, everyone that is keeping our high-needs students a priority to ensure that they get the services that they need to be able to survive and to thrive, because they cannot handle any more loss. They just cannot. Our families cannot continue to suffer anymore. So thank you for your time.
Thanks, Roxanne. And now I'm going to ask City Councilman Issa Asabi George to come up and say a few words about our most vulnerable families.
I'd like to thank Mayor Walsh and Superintendent Cassellius for their efforts over the course of the COVID-19 pandemic to create a plan for this school year informed by public health professionals and dedicated to the well-being of our kids. I also want to thank our educators, custodians, bus drivers, maintenance staff, and all of our BPS workers for working around the clock for our kids. Since the beginning of the lockdown, our school district has grappled with the devastating impact of remote learning, particularly on our highest need students. A population who receive critical and basic services in our schools due to disabilities, homelessness, housing insecurity, English language needs, and other complex issues. They need and deserve the care, attention, and basic needs available to them through safe in-person learning that is backed by public health guidance. For some of these students, having the option for in-person learning is so much more than just being in a classroom. For students with disabilities, it can mean access to their service provider for basic services, and many of those needs are not met through remote instruction like speech therapy or visual aid support, some of which Roxanne had referenced. For our students experiencing homelessness, it can mean the only stable environment to access social, emotional support and food security. Being in the classroom with trusted teachers and support staff is where they are at home and where they find safety. As Chair of Education and a former Boston Public Schools high school teacher, ending student and family homelessness has been one of my top priorities since joining the Boston City Council. Through my time on the Council, the Mayor and his administration have been a strong partner, helping to make Boston a leader in supporting homeless students and ending youth homelessness. Over the last years, we've identified 5,000 students experiencing homelessness, and we know that the economic impact of this pandemic has magnified that number. I've been proud to work with Mayor Walsh to secure $1.8 million in funding to support these students in their schools and to create new resources at the school level. I know from my time working on this issue that giving families with high-need students an option of safe in-person learning is the right decision for students and families experiencing homelessness. During the pandemic, I've had the opportunity to meet with BPS families directly impacted by the absence of these services because remote learning was impossible for their child. For these families, having the option of in-person learning is essential for their long-term health, safety, well-being, and academic achievement. I look forward to continuing to work in partnership with the administration and with our school leaders and our teachers across the district. Today's announcement represents an important step to ensure that these families and our schools are being supported during these difficult and unprecedented times. Thank you, Mayor Walsh.
Thank you very much, Councillor, and thank you, Roxanne and Superintendent Casilius. I want to thank Marty Martinez, Carolyn Kane, everyone that's here today. I'm confident that moving forward together as a community committed to supporting our most vulnerable students and families is something that we will do in our city. And to keep moving forward, I want to remind everyone, as the superintendent did, we're asking people to continue wear your masks, wash your hands with soap and warm water, continue to keep 6 feet distance from each other. Above all, we have to avoid parties and large gatherings of any kind. That's where we're seeing some of our numbers come from. Please don't put a party ahead of your ability to get our kids back to school. That's something that is really important. Just a couple of quick updates on housing, and I'll go more into it at the next press conference, but the state moratorium on eviction ends on October 17th in 10 days, and we're determined to prevent people from losing their homes. We've been working on filing an ordinance with the City Council on Monday, calling the Housing Stability Notification Act. It says whenever a property owner sends a notice to quit to a tenant, they must accompany that notice with information that will provide the rights about resources available for tenants. It's the first step in the process, and we're doing also some more important steps. I've testified at the State House on the Jim Brooks Stabilization Act to prevent evictions. It did not pass at the State House. Many of these preventions or precautions that were in this legislation would work for us right now and work for our most vulnerable residents around the city of Boston. Right now, we're facing a potential crisis. As a city, we must use the power of what we have to provide whatever we can do to help. So we're sending out a mailer in 9 different languages to 46,000 households around the city of Boston that might be in risk of eviction. It tells them clearly that they don't have to leave their homes if they receive a notice to quit. It's also, we're working with homeowners in the city of Boston to help them as well, because they're also hitting this very difficult financial time. And we're asking everyone to contact our Office of Housing Stability. We've also asked landlords, invited them to sign on to a housing stability pledge. To date, we have 25 property owners around the city of Boston, managers who provide housing to low-income renters and have agreed to sign our pledge. So we're asking everyone to continue. We're going to continue to work together, and I'll have much more information at the next press conference to talk about that. As we move forward here, a couple of last things I just want to say. Two more points, and then I'm going to open up for questions because I know there's a lot here about schools today. That's the main takeaway from today's press conference. The first thing is that the 2020 census, October 31st is the final day for the 2020 census, October 31st for signing up. We're asking people to go to my2020census.gov or call 844-330-2020. We're at about a 57% rate right now for Bostonians who filled out the census form. That is a bad number. We need to get that number higher. They're claiming in Washington the numbers across the country are higher. That's not the case. So I'm asking every Bostonian to fill out this form. Go to my2020census.gov to fill out the form. It's something that's really important. And I want to end, I usually try to end these press conferences on a positive note, but unfortunately today I can't. Yesterday, we all saw a disturbing video from VFW Parkway in West Roxbury. State Representative Eddie Coppinger reached out to me first with the video. City Councilor Annie Sabi-George reached out. It was a disturbing video to watch. It was unacceptable in so many ways. It violates someone's rights just because of the color of their skin, and it's unacceptable. Earlier this morning, I talked to the man in the video, and we had a conversation about, first of all, what was going through his head, but also understanding what this is about. I've reached out to the Boston Police Department to have them reach out to federal authorities to see what this is all about. It really, again, it's unacceptable, is the fact that ICE has not confirmed or denied if these were agents. In Boston, we believe in the power of community policing, and it's the important trust between law enforcement and our community to make sure that we ensure public safety for everyone. Incidents like this have no place in our city, have no place for this in our country, quite honestly. It causes real pain and fear and concern. So I just wanted to let everyone know that we are on top of this. We're working on it. That's all the information I have at this moment. And we're going to continue to be asking questions. And I plan on having another conversation a little later this morning with the gentleman that was in the video. I'm not going to reveal his identity right now because I'll let him do that. But clearly, he was shooken up yesterday. What he explained to me, and it's still unclear why this happened. So we're going to get more information on that. With that, I'll open up for questions for anyone that spoke today or that we have.
The protocols, we want to saw how much work went into them. How frustrating is it not to be able to use them out of the gate when they seem like they work? And then also, the same question is, a lot of people from outside of Boston send kids into Boston to go to school, private school.
Yeah.
Are they safe to go to school?
Yeah.
How frustrating, though, is it not using the protocols that seem to work?
Yeah, the question is about protocols that seem to work. Are you talking about the cleaning protocols and the protocols in the schools? Yeah, you know, lots of work has gone into reopening Boston Public Schools and private schools too. I mean, they've done their work too. We're on calls with them. Charters, parochials, we're literally on calls with them once a week, and they're looking at the data. It's disappointing that we've had about a 16-week period here in the city of Boston and Massachusetts that we've been an average of 1.8% to the highest 2.8%, and in the last couple of weeks seeing us hit the 3%, 3.5, 3.9, now 4.1. It's disheartening in some ways, and there's no one to blame. We're talking about a pandemic, a worldwide pandemic, and we're just asking everyone to be cautious now as we move forward. You know, the kids that are in our district, in our schools, they need to be. And there's so many other kids and so many other parents that want their child to go back to school. The complexity of our district compared to maybe a private school is a one school. And you're able to put precautions in that one school. We have 125 schools. Many of our kids, you know, might wake up in the morning and they live in Dorchester and their school is in Brighton, and we're busing them across the city, or they're taking public transportation. That's what makes things more complicated. I'm hoping to see these numbers come down, hopefully over the next couple of weeks, get out of the red, get under 4%, and then we can keep the phased-in approach. I am glad that we did the phased-in approach, because the phased-in approach allows us the opportunity not to disrupt the whole school. So as as we had as the kids that are in school tomorrow and yesterday, as they're in school, 90% of our students are online every day learning. So it's important that we continue moving, have the momentum moving forward.
There were a lot of teachers who were concerned about going back to sometimes those kids. And I know they've all described, some of them have discussed concern once it goes to 100%. So now that they still have to go back, because obviously there is a population that needs them, but what is your response to teachers who say we don't feel safe and they want to be here?
I mean, we live in a very difficult time. I've said it many times from here, and the fact that we're doing press conferences and you take a mask off to ask me a question, and when I leave, I'm putting a mask on to walk upstairs. It's one of these difficult times, but we're living with COVID, so we're adapting to work and move forward. And we've made sure that in the schools that we put all the precautions in place to make sure that we keep our teachers safe and keep our students safe. And we're going to continue to look at that. Marty, I think, touched briefly upon some testing. We're looking at expanding testing for our staff in schools. We have a testing facility at Fenway Park for teachers. Not many people have accessed that testing facility. So we're looking at how do we bring that testing closer to the school. So it's about testing, and it's also about washing your hands, wearing a mask, keeping, where you can't keep distance. Sometimes teachers can't keep distance, but they're wearing, in some cases, hospital-grade PPE, and in some cases they have different equipment. So we have to adapt to the situation that we're in. Yeah, there's a question. The question is there a point where we delay hybrid and go all remote? It's a great question. I can't answer it. It's unpredictable. This virus, since the summer, we've been on a steady decline in our cases and numbers. We have to have school. Our kids are better in school. We need to make sure we put the precautions in place that when we get under 4% again, for phase 3, 4, 5, and 6, it's all opt-in. So if parents and students feel they should go, they can send their kids to school, they will. And I think by that point they'll be comfortable. I don't want to answer that question, when do we cancel all school? Because if we're canceling school completely, we're in a whole different situation here in the city of Boston, the Commonwealth. We're in a situation where our restaurants are shutting down again, our business is shutting down again. We're not at that point yet, and we have a way to go before we get to that point. I'll come right back to you, Sean.
This is just the kindergarten sort of thing. It's not a domino.
Not right now, yeah. So sorry. So the phased-in approach is next Thursday, we were going to start phase 3. Let me just go from the beginning real quick to tell people. Phase 1 is online. We start school up. Everyone's learned online, remote. Phase 2 was the highest need students. They started last week. They came in Group A and Group B, and we started school. Phase 3 was to begin next Thursday. And then phase 4 was to begin 2 weeks from next Thursday. Phase 3 is being delayed a week. And then phase 4 is staying where it is. Phase 5, they're all staying where it is. We're going to look at the numbers to see where we are in the coronavirus. Obviously, if we're above 4%, phase 3 and phase 4 will probably have to be pushed a little further out. If we're under 3%, under 4%, or 4% or under, then we'll be able to have a conversation about starting phase 3 and then phase 4. And it's all opt-in. So if a parent chooses not to send their kids to school, and we're preparing our buildings for those, for the increase of students. Right now, as Roxanne said, our students, roughly we have about 1,300 students in schools right now, currently today. That's an average of about 10 per school, but some schools have 50 and 40 and 30 kids in them, so that's obviously not 10 kids. So what we're doing is the schools aren't full, so we're adapting to learn how we're educating and taking care of our kids in those situations. But we're also going to have, hopefully, in the course of the next month, more kids coming into school. So we phased it in so that leaders can find where the issues are, teachers can see where the shortfalls are, and how we can adapt and adjust on the fly. And this is constantly an evolution. Every day is going to change. Every way we're going to deal with a different situation is going to be handled differently, and we're going to learn things that we didn't know. So when we created the testing at Fenway Park for teachers, that was the first step. What we're looking at now is how do we create better testing around a school so the teachers on their way to school or maybe on the way home, they can get tested. And what's the system, and making sure that it's not just one test. It really should probably happen weekly, so to have a constant reminder. So we're adapting as we move on the fly. Again, COVID-19, there is no industry that quite honestly went into this thing understanding what was going on or coming out of this thing understanding what's going on. So we're still very much in the middle of it. Sean? As far as closing it down permanently? Well, I think what I'm looking for in the next couple of weeks, number one, obviously after our announcement today, I'm looking forward to seeing our kids with the highest needs continue to go to school and deliver them the services that they want and need and deserve, giving the families assistance that we support them 100%. Also, in the next coming weeks, making sure that our kids and our parents have all of the technology they need to learn, all the hotspots they need to learn, so as they do online learning, because the super majority of our district is still online, that we're giving them all the supports and everything that they need. We got another delivery, I believe, of Chromebooks the other day, so we're getting those out. So we just need to make sure our kids are learning. We also need to make sure that we continue to support our teachers, our staff, all of our staff, our school leaders in anything that they need to be supportive, whether it's something physical in the building or something that they need to just move forward, whether it's having testing or what have you. We also need, as a society, quite honestly, as Boston, we need to see the number come down. We don't need to see the number go up. And in the last couple of press conferences, I've been very clear on, if you gather at a party 25 people or more, there's a chance that somebody's a carrier of COVID, and all of a sudden now we have a super spreader event. We saw at the White House last week. We saw about 100 people sitting on, I think it was the South Lawn or the Rose Garden. Nobody was wearing a mask. Nobody was physically social distancing. Everyone was hugging, shaking hands, laughing. And in that one event, the President of the United States has come down with COVID-19, 3 United States senators, the Secretary of our Treasury, and a whole host of other people, top-level government people, in the Rose Garden at the White House by not taking the precautions they should have. That, first and foremost, is probably the biggest breach of national security in the history of our country, number one. But number two, it just shows you that no one is immune to the spread of the coronavirus. And whether that's in the Rose Garden, at the White House, or that's in your backyard in Dorchester or wherever, you're not immune to it. So we're asking people, what I'm looking for in the numbers, I'm looking for our numbers, our number in Boston, to get below 4% again and get down to the 1s and 2s and eventually 0. And I'm also looking for us as a city of Boston to get out of the red zone. This is the second week in a row now we've been in the red. We want to get out of that red zone. And the way we get out of that red zone is by us continuing to be disciplined. For 16 weeks, a lot of people have done the right thing and continue to do the right thing. Let's not have one event, and it could be just one event. Biogen was one event that they said 20,000 cases came out of it. Let's not have a repeat of that. Yeah, I mean, that's another reason why. I mean, the question is about the achievement gap with Black and brown students, and that's another reason why I'm so insistent on we need to try and get back to school, because that opportunity gap, that achievement gap, is not shrinking; it's growing. There's plenty of studies, and educators can be better at this than I am, but when students leave for the summer and go have the summer vacation, then come back in the fall, the reason why we created a program called Fifth Quarter was because young people not retaining the knowledge they learned in school. So Fifth Quarter got about 25% of our students to go learning in the summertime. That's why we're trying to advance those programs. Right now, we're talking about most of our kids will be 7, 8, 9 months out of school by the time they physically get into a building again. And that's why it's so important for us to think about how do we get this hybrid model working so that when we can get to the next phase, we can get kids back in schools. Not to mention what Roxanne said about the loss that our kids with the highest needs had. And listening to families and hearing the stories, many of you, I would suggest you go talk to the families. It's such a sad thing to see that in 7 months, that so many kids digress back in such a way that the parents don't know what to do. And in 2 days, that came right back, meaning kids were different and they were happy and parents saw a change. That's why it's so important for us right now to move forward here. The critics are going to criticize us, and that's fine, and criticize me, but I know the right decision that we're making today is to allow our special needs students the opportunity to continue to go to school. That's the right decision. If I or we feel that it's too dangerous for that to happen, I will shut school down again. I am not shy about that. I will do that. But we're making the right decision today. Yeah. Well, we don't have a number. What we're doing, we had a conversation yesterday. We talked about it. We talked last night. I mean, I said that question's going to come. I said the press is going to ask me, what's the new number? And I said to Marty, what do you think it is? And he looked at me, I don't know what it is. And there's too many factors right now that we're looking at. So it's not just a number. It's where we are in the virus in different neighborhoods. It's where the emergency room visits are right now. It's where, are we seeing an uptick in emergency rooms? It's going to, so we will keep you informed and get you that answer at some point. But I don't have a number today. I'll come back in 1 second. They're staying the same. They're not bumping out. Grades? Phase 2 is K0 to K2. Phase 3, I mean, sorry. Phase 3 is K0 to K2. And then 1 to 3, 4 to 8, 9 to 12. I'm going to ask Marty to try and answer that because, I mean, you know, originally we thought it might have been, did you go upstairs? Oh, he's right here. I think we originally thought it was college students and then not enough testing. Let me have Marty try and give you the best educated answer on that one because if whatever I say, you might be rebutting it later.
Thanks, Mayor. The question is, what do we think is causing this uptick? I mean, unfortunately, it's a combination of a lot of different things. I mean, you'll see from our latest neighborhood report that's on our BPHC website right now, most neighborhoods are seeing an uptick. So we know the neighborhoods, which are spread across the city. We also know the age range, which is really under 29, is where we see the largest uptick we continue to see. And we also see in the last 2 weeks the largest population being within the Latino community. And so again, that doesn't mean that anything in particular is happening, but we know who it's happening to and why we see the rates continuing to climb. So there's not one reason, but I think it's really important, the mayor's earlier message, everything that Bostonians can do to socially distant, to wear facial coverings, and to not gather in groups and wash their hands, all that's really important because we're talking about cases, just to give you a sense, if we had I think we had roughly a little less than 13,000 people tested in the last full week of data, and over 500 tested positive. So we're not talking about huge numbers out of 13,000, but it still matters when 10, 20 folks are getting testing positive based on either being in groups or in gatherings or because they're essential workers. So there's not one reason, it's sort of cut across the board.
Yeah. All right, yeah.
Yeah, so that's a new, the question was about Hyde Park. That's a new piece in our data. You may remember, though, however, at the very beginning of COVID data and COVID reporting, Hyde Park did have a very high rate at the very initial, when testing first started. It had a high positivity. And now this week to week, it has had the highest positivity in the last 7 days that we're looking at. So we're taking a look at it. Again, it's the difference. I think Hyde Park testing stayed flat, but I think they saw an additional 15 cases, which then can really skyrocket the rate. So it's really important to remember these rates, they move because we're really looking zip code by zip code, neighborhood by neighborhood, and small numbers do make a big difference in the increase. So we'll dig into the Hyde Park information and figure out what else might be needed there.
Thank you, everybody. Thank you for being here today.